good morning, everyone. My name is Melpo Pittara. I'm a PhD candidate at the University of Groningen, Netherlands, and at the same time, I'm a representative of schwannomatosis patient in NFPU organization. Today, we explain in simple language our system that developed at the University of Cyprus at the Department of Computer Science with my students in explainable AI system for schwannomatosis patients. And let's start with the problem. Why we need help? Why we need this project? Schwannomatosis and NF1 and NF2 are complex rare diseases. The diagnosis, as you know, is difficult. It needs imaging, genetics, and clinical expertise. Also, treatments are very rare, involve pain management, and also a lot of times surgery. And of course, you know, there are a lot of delays and uncertainties in diagnosis and can hurt patients. And what do we want? Doctors and patients need better tools to guide decision. So what's explainable AI? Artificial intelligence can help, but you know, it's typical, it's a black box. It's hard to trust AI, but here is come explainable AI and show why it make each suggestion the AI. So you can have a clear and accurate reasons for every diagnosis and treatment recommendation that the system appears. So our explainable AI system use Cognica. Cognica built using controlled natural language, the common CNL, but it means that it thinks like a doctor talks. And based on official clinical guidelines that we made in 2022 with ERN Genturis, we made the system that support decision-making for diagnosis, pain treatment, surgery, and genetic counseling. So how the system works? Doctors enter patient information like symptoms, MRI, genetic test. The AI checks structural medical rules from clinical guidelines and give the recommendation with a clear explanation. And at the end, the doctor and patient can discuss the recommendation and decide the process of the disease. And let's see the program. Where is? Okay. I'll already have a profile here. I'm a doctor. I'm Melpo Pittara. This is the information of the doctor. You can add whatever you want. And this is my patient. I add yesterday Kathy. And let's view her dashboard. So yesterday, Kathy has a test DNA that she showed us has MARCH-B1 and brain MRI and whole body MRI. Her pain is severe, and the system shows that has MARCH-B1, and the explanation is simple to understand the doctor and the patient, that the given fact that MRI, brain MRI, spine MRI, and whole body MRI, a test DNA is MARCH-B1, and the fact that schwannoma is proven supports the conclusion of MARCH-B1. And also we did another action about pregnancy, but let's see on real time what happened. Let's take, this is the profile of the patient. You can see the ID, the first name, the date of birth, the phone, the diagnosis info until now. And that is on the above line. You can see the section that is the most important according to clinical guidelines, like diagnosis, pain management, drugs, surgery, MRI after diagnosis, and reproductive period. Let's, for example, let's take the pain management. So the patient, let's pick, has MARCH-B1. You can pick here the pain of leather. Let's say that Kathy have severe pain, and also let's go to the level 3, that the patient take all the assessments like pain history, assessment of quality of life, full neurological exam, and psychological needs. And we say yes, and we come here and we click to show, and we click here to processing and show the system what is the recommendation. Now the system is connect with Cognica, and it comes thus, please check if you did not forget to choose any action that you have already performed. So the system show us that we have to pick if it's surgically removable her tumor. So I said yes, and she has a disability. I choose confirm, and let's see what. So the system showed us, according to clinical guidelines, that Kathy has to take drugs and surgery, and the explanation is that the given facts that is surgically removable the tumor, and did all the assessment, and has the SMARCB1 gene, and has, of course, pain severe. Suppose the conclusion she will take drugs and surgery. You can see here the link. If you click it, it sends you to the genetic tumoric syndrome Sierra Cheturis, which is the clinical guidelines. And of course, it's very important that the doctor has the final decision. So the doctor can accept or deny the recommendation of the system. And you can see here, if we go to dashboard and view Kathy, 3rd of May, this time, the result was drugs and surgery. The patient took these actions and the explanation of this, and doctor click accepted. Also, there is, 1 minute. There is another part you can pick one. I will show after that a QR code you can scan and try the system. And there is information about schwannomatosis, what is the genes that affect schwannomatosis, the common symptoms, and what is explainable AI, the rules to show every action. You can study them because we don't have a lot of time here to go past all of this. And let's continue with the presentation. So what is the benefits for doctors? Of course, they save time by suggesting evidence-based actions, reduce the diagnosing uncertainty, because the doctor he's not reading the whole guidelines draft, which is according 50 pages, but you can pick it or choice, and the cognitive the system does this for you, provides structured explanation for its recommendation, and as I said before, doctors stay in full control of the final decision. And of course, the benefits for patients. It's important to understand why a test or treatment is recommended, because lots of times as a patients, they don't explain us why we want this test or this MRI. We feel more involved and informed. We build trust in the care process. Of course, the system gets personally treatment plans for each patient according to the data. The results so far, we simulate clinical cases and show us improved decision transparency. We have some positive feedback from our doctors in Cyprus. They trust, they say more because it explains the system. And of course, we want to expand this to NF1 and NF2 diseases, and also to other rare diseases. And at the end, I have some questions that you might have now. The first question is, can doctors override the AI recommendation? Absolutely. You saw this before in the system. Doctors remain fully in control. The AI only suggests and support option based on the current best practices. And does the system integrate with hospital records? Integration is planned right now, it's standalone the system, but designed to be compatible with the standard EHR formats of European Union. With AI, decide my treatment without doctor? No, definitely no. In any case, only the doctor makes the final decision. The AI just helps doctor by giving clear evidence-based option. Can I see the explanation the AI gives? Yes, the explanation are in simple language and can be shown to the patient to support open conversations. What if the AI gives wrong advice? The doctor is in a position to check every suggestion and deny or accept it. And as I said before, the AI is a guide, not a decision maker. And what will this make diagnosis faster? Yes, this system can be helped by organizing information clearly and speeding up guideline-based decision, especially in complex cases. And one important question, is the AI biased? In this case, it's not biased because it's based on clinical guidelines, not personal data patterns, which helps minimize the bias, but we still monitor it carefully. What if guidelines change and how fast the system can adapt? Updates can be made quickly because the system is built on structure, rules, and decision-making logic, so not machine learning models, so it's very easy to adapt the system. And at the end, I conclude with quote, explainable AI empowers both doctors and patients. And together, patients and doctors, we can improve diagnosis, treatment, and trust. And in the slide appears a QR code. You are scanned it and try the system. It's very important from us to have your feedback. You are the patients, you are the experts, so don't hesitate to contact with us and tell us your opinion. Thank you.